Hello, Facebook. This is Joe from Joe's Body Shop. Welcome to our Facebook Live session today. And if you were watching the Colorado Springs School of Massage episode that just closed out a minute ago, we were talking about arms and all the complexities of the arm. Well, I'm going to show you about the arm and what to do about it. Matter of fact, we've got a tennis elbow that needs to be dealt with. Come on in here. We've got our demo is all ready to go. This is Debbie, and she was trying to play racquetball left-handed. Silly girl. And she came down with tennis elbow. Now, in the medical community, we've mentioned tennis elbow is actually lateral epicondylitis. So, the lateral aspect of the arm is out here. Epicondylitis is above here. So this is where the muscles are attaching. And I'll show you, this is where she was telling me her pain is. But she's also experiencing pain down the arm. So we're going to need to deal with that. Let me show you the diagram that we showed in the school's video. These are all the muscles on the forearm where they attach into. Now they're not attaching into the bottom, the forearm. They're attaching to the very end of the upper arm. So we're going to need to go in there and deal with that. So we're going to start off rather gently. Let's warm the area. And I am actually feeling for inconsistencies in the muscle tissue. We're looking for areas of tension. See, there's already tension in here. There's a lot of tension in here. It's actually even a little bit warm. Sorry, Debbie, I know this is tender. You doing all right? Mm-hmm. And we're going to come down in these areas where Debbie expressed that, yeah, there's pain down here too. Now, in previous videos, you may have noticed that I don't use a lot of oil. Matter of fact, I didn't even bring my oil belt with me because a lot of this work, see, I'm rolling that muscle under my thumb. Is that too much? Okay, we'll go gentle because this is fairly fresh for Debbie.
I do a lot of keyboarding too.
A lot of keyboarding. And although this is not our mousing hand, usually the mousing hand develops a lot of tender spots in the forearm. And so we're going to follow the pathway that pain signal was following. And what I'm doing is I'm looking for the muscles that are involved. And for those of you that are smart, you want to get techno-geeky with me. These are the flexors or extensors? Extensors of the wrist. So we've got down here, we've got the extensor carpi ulnaris, extensor carpi radialis, and in between, we've got the extensor digitorum longus. And that's where I'm finding the bulk of this. Am I remotely triggering your fingers, Debbie?
It's special.
Oh, it's your road rage finger. Oh, I get it. Okay. And so we're going to go in there. We're going to soften all of this up. You'll notice that I'm pulling the tissues and stretching them out. As I stretch them out, I'm breaking up the fascial adhesions in there. And although this initially is not very pleasant, it eventually feels amazing. You liking that, Debbie?
Oh, in the forearm, yeah. Around the elbow, no.
Well, because that's where the source of the problem is. Very cool. While I'm working this, does anybody have any questions? Any comments?
You know, I was just thinking, Joe, as your camera operator here.
Yeah.
A lot of these maladies started showing up, from my perspective at least, the more we had more of the population working with keyboarding.
That has tremendously contributed to a lot of our problems. And I kind of have my own theory. When we were created, we were not designed to sit all day long. We were not designed to have our arms forward all day long. We were not designed to be doing this all day long either. You stop and think about it, the curves of the spine come into play here. When you're sitting down, your lumbar curve is not normal, your thoracic curve is not normal, and your cervical curve is not normal. When these curves are not normal, we start introducing stresses to the nervous system and to the muscular system. We've got a lot of compressive forces on us when we're standing up, when we're erect, and the curves in our spine, they are there. They were designed to help us offload some of that compressive force. But when we sit all day long, the spine is more straight and the compressive forces are jamming down on those vertebral structures. And when they get jammed, then the nervous system gets involved because a lot of nerves pass out of the vertebral column. And if that's not working correctly, the nerves start getting pinched. And now we start getting all of these little crazy aches and pains that we don't even know where they're coming from. And that's because we're not moving around enough. And so this is one of those things. Debbie loves to be the admin here at the shop. And when she sits down to pay bills, she's on the computer for 3 days, making sure that everything is perfect. Then this happens. Especially when you go to play racquetball left-handed. Huh? This has gotten a lot softer to my touch. Is this feeling less tender, Debbie?
In the bulk of it, yeah, there's still outlying areas that are tender, but the middle of it feels a lot better.
Awesome. So let's come out here and find some of those outliers.
I know that a lot of musicians, guitarists, drummers, keyboarders, they deal with what we call repetitive motion injuries, or RMIs.
Mm-hmm.
And any task you do repeatedly is ultimately going to cause problems.
Exactly. And I can only imagine a drummer practicing a new song, just doing this all day long. Can you imagine the activity that's going on in those forearms?
Mm-hmm.
Oh, yeah.
What about numbness, Joe, for people that do repetitive activity?
Well, numbness is starting to indicate that there's a nerve involvement. And so when you've got, they call it dysesthesia, which is abnormal nerve sensation. You can get that in the hand, you can get that in the forearm, upper arm, you can get it anywhere in the body. But for people that are repetitively using their arm and forearm, usually it's from the forearm on down, it can get so bad that you'll start losing sensation to the point where you lose your grip on a glass. You can lose strength in your hand. It's not a good thing. And if you start feeling that, please go get seen. Go visit your massage therapist and or your chiropractor. Either way, you're going to get some body treatment that's going to identify where the problem could be sourced.
So somebody watching this right now has that going on. They can get a hold of you.
Absolutely. Right? Give us a call. We are very, very specialized in our massages here. Very rarely will you get just a relaxation foo-foo massage. We seem to attract the people that have got problems, that they need some real serious massage. And we do tons and tons of therapeutic work. And if you notice what I'm doing, this is not about making mommy feel good. This is about fixing mommy's forearm so that she'll give me a big tip. Huh.
Yeah.
I tease about that. But the truth is that if you can go in there and break up an adhesion, if you can repair some of the damage that's been done here, this can help her return back to normalcy and be out of pain.
Wow, that's
really
incredible.
That.
That's really good.
I can tell you that 2 weeks ago, I was waking up in the middle of the night with my finger and my thumb going numb, both arms. And between Joe and Scott, I see Scott Cathy for adjustments. I'm happy to say I can sleep through the night without my arms and fingers going numb.
Mm-hmm.
So in as little as 2 weeks, it's gone.
Right.
Wow.
And when we say 2 weeks, that doesn't mean nonstop therapy.
No, that's three visits.
It's 3 visits a week, and that really, really will help you. It'll speed up your recovery process.
Yeah.
You'll really be glad you did. I promise.
I know I am.
And one of the things too that you'll find that we do here at Joe's Body Shop, we don't just focus in on this, because guess what? For this to work correctly, everything down channel of it has to work correctly. Everything up channel has to work correctly. So when we work here, then we start to spread out to areas of the body that could contribute to this. And many times, pec muscles, which attach to the upper arm. We have upper traps, which can sometimes be involved in this. Up into the neck. We check all of it, and we're doing it through palpation. And in these palpations, we're actually kind of testing and looking for inconsistencies. We're looking for imbalances. Because if this arm is messed up and I ignore that arm, guess what? That arm's coming back next week with problems. So we tend to focus on the entire body and make sure that everything is working correctly before you're done with your massage. So for those of you that are on the keyboard all day long, that are driving the big rigs or trucks long distance, and you're like this all day long, and you've got problems with your back, or you've got problems with your neck and shoulders, or you've got problems with your forearms, give us a call at 719-444-0708. We have got 3 amazing Joes working here. We got me, we've got Kiani Joe, and we've got Emmanuel Joe. We're all Joes here, by the way, if you didn't get that. But give us a call. We've got plenty of time on our calendar. We've got room to bring you in. We can get you in as quick as next day. So give us a call, 444-0708. Look us up online, joesbodyshop.com, and you'll see a bunch of cool stuff on there. But until the next time we see or hear from you, we can't wait to get our hands on you. Give us a call. Have a great day. Bye-bye.